Just imagine. A 68-year-old woman clutches her chest aboard a luxury cruise ship, 200 miles from the nearest port. The ship's single doctor rushes to help, but the medical center lacks the equipment found in any small-town emergency room. This scenario plays out more often than cruise lines want passengers to know, and what happens next could mean the difference between life and death. Welcome to Cruise Safe, where the truth about cruise ship medical care gets revealed. Today's investigation exposes hidden dangers that every senior cruiser needs to understand before stepping aboard. The information shared here could save not just money, but lives. The reality check: what cruise medical centers really are. The glossy brochures show sparkling medical facilities, but the reality shocked even medical professionals. Dr. Liz Baugh from Scenic Cruises revealed in 2025 what cruise lines desperately downplay. These facilities operate as basic urgent care clinics, not hospitals. No MRI scanners, no CT equipment, no surgical capabilities beyond simple stitching. The ABC series Dr. Odyssey, which premiered in 2024 and continues captivating audiences in 2025, portrays cruise medicine as glamorous with state-of-the-art facilities. The truth? Most ships operate with one doctor and perhaps two nurses managing thousands of passengers' health needs. That's one medical professional for every 1,500 people, working in a space smaller than most dental offices. Consider what these medical centers actually contain: basic X-ray machines, often outdated models, simple laboratory equipment for basic blood tests, limited medication supplies, one or two beds for observation, basic cardiac monitors, minimal emergency equipment. While cruise lines boast that 95% of medical cases get handled on board, that remaining 5% represents the serious emergencies where limited facilities become life-threatening. For seniors, who comprise over half of all cruise medical center visits, these limitations pose particular risks. Hidden danger. 1. When geography becomes deadly. The July 2025 medical evacuation from a Carnival ship during Pacific tsunami warnings exposed a terrifying reality. Coast Guard helicopters won't fly if ships sail more than 500 miles from shore. Weather conditions, mechanical issues, or simultaneous emergencies can delay evacuations by days. During that July incident, a passenger experiencing cardiac symptoms waited 6 hours for evacuation as the ship navigated tsunami-threatened waters. The ship's medical team could only provide basic support while precious time ticked away. Every minute without proper cardiac intervention increases permanent damage risk. For seniors with conditions like heart disease, diabetes, or stroke risk, these geographical limitations become potential death sentences. The nearest hospital might be days away, and cruise medical centers lack equipment for anything beyond stabilization. Hidden danger 2: the financial shock that follows medical care. In July 2025, Reddit erupted when a Norwegian cruise passenger posted their medical bill for a minor issue. The breakdown stunned even experienced cruisers: $219 just for walking through the medical center door, $219 for a basic doctor consultation, $274 for a simple COVID test. Total, over $700 for care that would cost $100 at any urgent care clinic. But here's what cruise lines never advertise: Medicare doesn't cover cruise ship medical care. Neither does most private insurance. Seniors who often live on fixed incomes face bankruptcy-level bills for basic treatment. The popular Twitter account at Daily Dot called these fees diabolical, sparking widespread outrage. The financial dangers extend beyond consultation fees. IV treatments, $500 to $1,000. Basic medications, 10 times pharmacy prices. Oxygen therapy, $200 per hour. Medical evacuations, $50,000 to $150,000. Travel insurance might reimburse some costs, but passengers must pay upfront and wait months for potential reimbursement. Many discover their policies exclude cruise ship care or cap coverage at amounts far below actual costs. Hidden danger 3: when outbreaks overwhelm. May 2025 brought CDC warnings about new norovirus strains causing multiple cruise ship outbreaks. By July, Royal Caribbean's Navigator of the Seas faced a full-scale medical crisis as the virus spread through the ship like wildfire. Norovirus causes over 90% of cruise ship gastrointestinal illnesses, and these outbreaks reveal the medical system's breaking point. With attack rates reaching 30% of passengers, a single doctor and two nurses face impossible mathematics. treating hundreds of severely ill patients with limited supplies and space. During the Navigator outbreak, medical staff ran out of IV bags within 48 hours. Anti-nausea medications depleted. The single treatment room overflowed with dehydrated passengers. Staff triaged in hallways, choosing who received precious remaining supplies based on severity rather than need. For seniors with compromised immune systems or chronic conditions, norovirus poses extreme dangers. Severe dehydration can trigger heart problems, kidney failure, or dangerous medication interactions. Yet cruise medical centers lack resources for managing these complications during outbreaks. These revelations about cruise medical dangers are just beginning. To protect yourself and loved ones with more life-saving cruise safety information, subscribe to Cruise Safe now. Knowledge becomes power when health emergencies strike at sea. Hidden Danger 4. When doctors miss critical diagnoses. August 2025 brought a disturbing report from @B.J on X. A passenger on Royal Caribbean's Wonder of the Seas suffered a head injury with loss of consciousness, yet the ship's doctor failed to evaluate for concussion. No neurological tests, no follow-up protocols, just basic pain medication and dismissal. This incident highlights a terrifying pattern. Cruise doctors, often trained only in emergency medicine, lack specialization in neurology, cardiology, endocrinology, orthopedics, and psychiatry. The July 2025 Icon of the Seas tragedy, where a crew member stabbed another before jumping overboard, pushed medical staff beyond their limits. They stabilized a trauma victim with basic equipment while managing psychological crisis aftermath, all without specialized support. For seniors managing multiple chronic conditions, these limitations prove especially dangerous. A misdiagnosis or improper treatment can cascade into life-threatening complications. Yet cruise medical staff must make critical decisions with minimal diagnostic tools and no specialist consultation available. Hidden Danger 5, the legal loophole that leaves you vulnerable. Maritime law firms like Lipcon, Margulies, and Winkleman exposed in 2025 what cruise lines desperately hide. Ships aren't legally responsible for medical malpractice. Doctors work as independent contractors, not employees, creating a legal shield protecting cruise lines from liability. The Florida Supreme Court confirmed this shocking reality. When medical negligence occurs at sea, passengers have virtually no recourse. Protection strategies, your medical safety blueprint. Knowledge transforms into protection through preparation. Here's the comprehensive medical safety strategy every senior cruiser needs. Before booking, research specific ship medical facilities online. Call cruise lines directly about medical capabilities. Verify doctor credentials and certifications. Check distance from ports along your route. Read medical care reviews from recent passengers. Essential medical documentation. Complete medical history summary. Current medication list with generic names. Emergency contact information for all doctors, recent test results. Medical power of attorney documents, insurance information knowing coverage limits. Medication management. Bring 50% extra medication beyond cruise length. Split medications between carry-on and checked bags. Keep prescriptions in original containers. Carry written prescriptions from your doctor. Pack common over-the-counter medications. Include medication interaction warnings. Insurance essentials. Purchase comprehensive travel medical insurance. Verify cruise ship medical coverage specifically. Ensure medical evacuation coverage minimum $150,000. Understand reimbursement procedures. Keep insurance contact numbers accessible. Document all medical expenses meticulously. Emergency preparation. Create emergency medical information card. Share medical details with travel companion. Identify nearest quality hospitals at each port. Program emergency numbers into phone. Establish communication plan with family. Know location of ship's medical center immediately. Have you or someone you love faced medical emergencies while cruising? What happened when you needed care at sea? Share your story in the comments below. Your experience could prepare another cruiser for the unexpected and potentially save a life. Red flags. When to reconsider cruising. Certain medical conditions make cruising particularly risky given these limitations. Recent heart surgery or unstable cardiac conditions. Insulin-dependent diabetes with history of complications. Kidney disease requiring potential dialysis. Recent stroke or high stroke risk. For these situations, shorter cruises staying closer to quality medical facilities offer safer alternatives to transoceanic voyages. The industry's response: empty promises. Cruise lines respond to medical criticism with vague assurances about qualified medical staff and well-equipped facilities. yet they refuse to specify equipment lists, doctor qualifications, or actual capabilities. This deliberate opacity keeps passengers uninformed about real risks. Some newer ships feature slightly improved medical centers, but fundamental limitations remain. No cruise ship matches even a small community hospital's capabilities. Marketing glosses over these realities, leaving seniors particularly vulnerable to false assumptions about available care. Making informed decisions. Cruising can remain safe and enjoyable with proper preparation and realistic expectations. The key lies in understanding limitations and planning accordingly. Never assume cruise medical care equals land-based standards. Always prepare for worst-case scenarios. Consider these alternatives for safer cruising: river cruises with frequent port stops, coastal cruises near major medical centers, shorter voyages reducing risk exposure, itineraries in developed countries with quality health care, cruise lines with better medical facility reviews. The bottom line truth: cruise ship medical care operates decades behind land-based standards. Limited equipment, overwhelmed staff, legal loopholes, and extreme costs create perfect storms for medical disasters. Seniors, who comprise cruise lines' core customers, face the greatest risks from these systemic failures. The July 2025 tsunami evacuation, the Norwegian cruise billing scandal, the Navigator norovirus outbreak, and countless unreported incidents prove these aren't isolated problems. They're inherent to cruise medicine's broken system, yet knowledge empowers protection. Understanding these hidden dangers allows informed decisions and proper preparation. Cruising doesn't require accepting unnecessary risks when you know what precautions to take. Your next steps. This investigation into cruise medical dangers represents just one aspect of cruise safety seniors must understand. Subscribe to Cruise Safe for continued revelations that protect your health and wallet at sea. Next week's investigation: what cruise lines don't tell you about port safety, including the destinations where crime against seniors spikes and how to protect yourself. Share this video with every cruiser in your life. When medical emergencies strike at sea, preparation makes the difference between a minor inconvenience and a life-threatening crisis. Remember, cruising can be wonderful with proper precautions. Stay informed, stay prepared, and most importantly, stay safe. Until next time, this is Cruise Safe, protecting seniors one voyage at a time.